Okay, so in this video, it's going to be another video for our variety of different programs that you should probably create for your home health agency to be able to make yourself stand out. Now, this will work well with hospice, home health, as well as home care agencies as well. And this is, creating a diabetes care program. Okay, so let's go ahead and get started. So you want to be able to create a diabetes management program. What this does is that you can be able to detail the information on how your skilled nursing company, your physical therapy, your home care company, and your occupational therapy companies can assist the patient with diabetes. And also at the very same time is talk about how each individual patient can be cared for, depending on what type of diagnosis they have, whether they have diabetes type 1 or type 2, or they have additional symptoms in addition to the diabetic problems, such as diabetic retinopathy, changes in vision. You can also talk about if they have diabetes with polyneuropathy, which is decreased or funny sensations or weaknesses. So you want to be able to talk about information about diabetes and to be able to explain to them what your agency can do, your skilled nurses, how they can complete the history and physical assessments. They can go ahead and look at the disease process teaching, if the patient has any wounds, how they can provide treatment for the wounds, as well as educational tools for the patients and for the caregivers and families. Because remember, we're not going to be there 24/7. We're going to be there every now and then to be able to be a supply, to be able to provide additional services and support for the original caregiver. We want to be able to teach the patient themselves to care for themselves, or teach the family members or the caregivers or the loved ones what they need to do to be able to help out to take care of the patients. You want to be able to provide medication review and teaching, talk about the blood sugar monitoring and teaching. If the patient is able to actually have a telehealth program added, maybe we can add the telehealth program so that we can monitor the blood sugar more seriously. We want to be able to have skin assessments and skin care education. One of the biggest problems of patient with diabetes is the problems that the fact they may get wounds. And by us providing skin assessments and skincare education, we can prevent the possibility of them having wounds that would cause more problems in the near future. You want to be able to provide education on insulin injections and implementation and compliance so that they know what they are doing. Your therapy, your physical therapy can provide therapy assessments. They can provide neurological testing, home safety evaluations. They can provide equipment evaluations and how to use them properly. They can provide assessments with strengths and range of motions and ambulations and balance assessments. They can provide patient caregiver education on what they can do to better themselves. You have occupational therapy. They can complete OT assessments, work modifications that can provide ADL retraining. They can provide visual acuity assessments and retraining. These are things that your company, your agency can provide and should provide. But by you being able to detail it out, to be able to tell that story on what your company can do for these patients, it is very important for you to do that. And at the very same time is, if you are able to do this, you're not just knowing that the patient is not just the one knowing it, your referral sources knowing it, your staff needs to know about this also. Your diabetes program needs to be make sure that it is actually attacking the problem that's existing. Remember, diabetes is a serious and chronic disease that occurs when the body does not have the ability to produce insulin or enough insulin to be able to metabolize glucose. This is something that needs to be explained to the patients, to the family member. You need to educate them. There is no known cure for this disease, but research continues to make progress. Now, remember, according to the American Diabetic Association, diabetes affects 25.8 million children and adults in the United States. For people over the age of 65 years old, there are 10.9 million of them, or 26.9% have been diagnosed with the disease. Early diagnosis is very important so appropriate diabetic care and management can be initiated. Some complication may arise, which may include heart disease and stroke. You have high blood pressure, blindness, kidney disease, nervous system disease, and amputation. In order to be able to reduce the complications, we want to be able to make sure that we manage the disease. it is essential for us to manage the disease and to be able to help the physicians with managing the diseases. So we have to make sure that we bring in any modern day approaches to the care of diabetes and talk about any dietary management for that particular client. Are you aware that you can actually have a dietitian visit the patient, that this is covered under Medicare? So talk about that. Talk about how you can send a dietitian to the patient, that you have contacts for a dietitian that can evaluate the patient, evaluate their diet, and to be able to give some suggestions and advices. Your job as a company is to provide a lot of information so that you can share and show that you have knowledge, that you are the right person for them to start referring to you. So remember, create a diabetes management program, market it, show it, and make sure you know about this type of program. You guys have to understand there's going to be a lot of home health agencies out there that are saying that they have a diabetes program, but they have no clue and cannot explain it specifically to the physician on how it actually is applied to the patient. This is where you as a marketer and as a company needs to create products, needs to create flyers, pamphlets, videos that shows this is what you guys actually do. This is a specialty that you guys actually do. And how do you become specialized in it? Is to be able to first provide the services, but at the same time is detail and explain it to the referral sources to show them that if you know about the services and can explain it to them, that means more than likely you're able to provide the services correctly. So create a diabetes care program for your agency. It's such an important thing and can help you get more referrals. So always understand home health is marketing. Home health marketing is easy when you know what you are doing.